Adeaga family. So today I am hanging out with my friend Toun, and this is actually an impromptu episode. We had lunch. We just had lunch.
Yeah.
And during lunch, we talked about a few things, and I suggested that why don't we have a hangout about this thing that we're talking about, especially because this month is Mental Health Awareness Month.
Yeah.
And next week is, in the UK especially, is Mental Health Awareness Week.
Yeah.
So some of you may recognize Toun. She's been on Hangout Cafe. Is it once or twice?
Twice.
Twice.
Yeah.
But I'll leave you to introduce yourself again, for those who don't know you.
Okay. So my name is Toun Alli-Adam. I am a clinical counselor, an oncology counselor, and a psychotherapist. I work for the NHS, and I also have my own private practice. I am very, very interested in working with people going through their cancer journey.
Thank you. So, as we said, it's Mental Health Awareness Month. And I'll tell you one of the things that triggered this off for me. I watched a video. Some of you may have come across it on Instagram. These two gentlemen, they were at, I think it was a football match or something. And one of them was very sober. The other one was, very boisterous, very buoyant and all of that. And he was trying to get his friend to, loosen up when the football match, but the friend wasn't having it. And the video later on goes to an empty seat, where I believe the man had, the one that was boisterous, the one that was vibrant and, had committed suicide.
Yeah.
And we said that, sometimes it's not so obvious who, those who are struggling with suicidal thoughts, those who have mental health issues. Yeah. Some of them are the supposedly happiest people.
Yeah.
So Toun works with a lot of mental health patients. She works, as she says, she works with cancer patients too. And I just thought, so what do you think? Why is it? I mean, one of the things we talked about when we were having lunch was that a lot of men don't talk about these things.
Yeah.
Why do you think? What is it? Is it the stigma, or what is it? What do you think it is?
Well, it's many things. According to our culture and men in general, men are meant to be the strong ones, not having any issues. Being vulnerable is like a no-no. They have to be strong. There's shame. They don't want people to make fun of them. And it really isn't so. But maybe some people have had experiences where they've spoken up and they've been shut down or been made fun of. So that's there as well. And women have each other to talk to sometimes, but men talk about different things, other things. They don't want to talk about the things that are going wrong. They want everything to be right. So now people are beginning to speak up, and men are beginning to speak up, but we need more. It's not enough. It's more difficult for men when they're going through the mental health issues and they suppress it.
Right.
And we want them to know that it's okay to find somebody they can talk to and talk about it, because it's going to affect your day-to-day, everything you do generally, if you're not talking about things that are bothering you. But then it's society. They think men should be strong. They shouldn't have issues. Everything should be fine. And it's not so. Life is not so.
Too, we've had this, I think we've had at least 2 or 3 sessions on Hangout Cafe where we've talked about mental health issues, especially with men and others. But it looks as if we are still not getting this message across. Oh, and I remember someone that I spoke to recently said that the few times that he's tried to talk about his issues, he's been laughed at. So that is a big problem.
Yeah. Well, it is a problem, but also it doesn't have to be a problem. Sometimes we have to choose who we talk to. Sometimes we have to believe that what we're talking about or what we want to talk about makes sense, can help somebody else. We have to believe in ourselves first. So I will choose who I go and talk to, and knowing that these people will listen to me. So who are they talking to? Maybe they need to talk to a professional. A professional is not going to judge you. They're going to give you a safe space to process this stuff. So maybe it's who they're talking to. And I know that can put people off. When you talk to someone and they make fun of you, that can just shut down things. So please choose who you're talking to.
But even the fact that amongst Black people, there's still that thing about seeing a therapist, seeing a
Yes.
professional.
Yeah.
Because I remember when we have lunch, you said that amongst your patients, it's like, is it 1 in 10?
Yeah, 1% of
1%, yeah.
are men.
Wow. Only 1%.
Only 1%. And I want I want the men to know that if you go and say professional, it's going to be a safe space. Everything you talk about is confidential, and the professional is bound by the association they belong to.
Yeah.
So it doesn't go further. Everything you talk about is confidential. It doesn't go further. So you can express and process the stuff that are bothering you, so you don't carry it around.
You see, one of the reasons why I wanted us to do this was because I want people, whether you're a man, a woman, a child, I want you to know that whatever you're going through, you don't have to go through it alone. There are people out there that can help. Even if you say you can't find a friend to talk to, there are professionals that can help. If you're in the UK, the Samaritans are here. And I'm sure there are other organizations. I can't think of.
Red Cross.
Okay.
And it depends on what's going on. There are different charities for different issues. Also, seeing a professional doesn't mean there's something wrong with you.
Yeah.
You might just need somebody to listen to you.
Yeah.
You might need to offload the things you're carrying around.
Yeah.
And besides, no one's going to know you're seeing anyone. It's between you and the professional.
Absolutely. And also, again, we talked about this, Christian folks. There are a lot of things we just want to pray with. And believe me, prayer works. There's nothing wrong with praying about whatever situation you're going through. But I also want you to know that whilst you're still praying, you can see someone, you can talk to someone. So this, please don't suffer in silence. Speak to someone. Pick up the phone. Speak to one of the Red Cross, Samaritans, or I don't know, maybe in your local area, they might have an organization that can help. But whatever you do, don't suffer in silence. It's any other thing.
Also, sometimes when people go to the GPs, GP will refer them to IAP, to NHS. There's always a long wait, and that could put some people off. Try other places like Mind.
Yes.
Mind is really good. Try other places like Mind, or see a professional, even if it's just one session, just to have an idea of what therapy is like. But don't give up. There are other places too. And if you can just find somebody you can talk to, ask them, is it okay to talk to you about stuff? Another thing you can do on your own is journal. If you can journal what's going on for you, you might not even understand what you're writing about, but just write it down. Like you're letting it go, or you're looking for an outlet. And if you feel somebody else will see it, then tear it up and put it in the bin.
Yeah.
But write something down instead of carrying it around. Because suppressing all this stuff affects the mental health, affects the mind. And this is when suicidal thoughts come in and all that. And that's what we're trying to prevent. You can talk about the stuff. As a therapist, people come with different issues. So nothing is new. And so we can handle it.
Yeah, nothing, like she said, nothing is new. There's nothing you're going through that is new. And also, you are not alone. And is there any other practical thing that can do, even whilst they're waiting to see a therapist? Is there any other practical thing that you can do?
I think exercise. I understand that going for a walk or going swimming or exercise in general does help the mind and the body. Your own things you can do. Maybe watch what you're eating. Maybe watch the people or what you're taking in. Maybe what you're watching. Maybe TV. I can remember sometimes when I'm working some Daily Mail. I don't know why. There's some messages that will pop on, and it's about something bad. Somebody's killed. So if you're taking all that in, that too can affect you.
Okay. So watch what. Be careful what you watch.
Yeah.
Or listen to. Yeah. Your environment matters. Yeah. Environment also is very important. So go for a walk. Take a walk if you're able to. Watch what you
exercise.
Eat. Exercise, yeah. Watch what you eat. Exercise.
Journal,
yeah. Okay.
Talk to a friend. A friend you trust.
Yeah. Friend. Also a friend you trust. Okay. So please reach out to someone. You're not alone. Okay, the other thing we said we're going to talk about is cancer.
Yeah.
Between us, we know so many people that are going through this cancer. And it's different one: breast cancer, pancreatic cancer, prostate cancer, ovarian. Now, Toun, as she works, as she said, she works with cancer patients, but also she's been doing a lot on social media trying to raise awareness about this the various type of cancers. Do you want to tell us a little bit more?
Research says that 1 in 2 people will get cancer.
And when she told me that, I said, I reject that.
I reject it too. But as we get older, there's going to be something or the other or not. Or we might know somebody who would have cancer.
Yeah.
Or a friend whose parents has cancer. There's cancer. Cancer is there. If you have to fight it, you have to do your bit. You have to go for the checks.
Yeah.
There's screenings there.
Yeah.
Go for them.
Oh, I had my mammogram yesterday.
Oh, that's nice.
So that's one thing.
Good.
As women, I think once you're over, I can't remember what age it is here.
What is it, 55 now?
I can't remember.
But
you go for regular screening. Yeah. And if you can afford it, go for a private one. If it's not even, because you hear of people who are, in fact, somebody was telling me, a lady who's 29.
Yeah.
She had breast cancer.
Yeah, it might be hereditary.
It might be, okay.
Okay. So, the screenings, if you're invited for screenings, please attend them.
Yeah.
Check your body. We share different videos about how to check your breasts for lumps. It's your body. I keep on saying it. We pray to God that we live long, because we want to live long or for our children and other. Yeah. But that same body is going to carry you. So you have to look after that body.
Yes.
Check your body for lumps. Go for the screenings. I just need you to do your best and leave the rest. You do something. Not that when something now happens, no. Just do your own best.
And, when you know your body, I think most of us know our bodies very well. And if you feel that something is wrong, go and check it out. Even if you're praying, I do that a lot. Once I start to feel something, I pray, and I say, Lord, this is not my portion and all of that. But I still go and check it out. Because, God can work a miracle through treatment if there's something wrong with you. But don't just leave it and try to ignore it and hoping that or praying that it will go away. In some cases, yes, it does go away. But I think that we have a responsibility to ourselves to go and at least check it out.
Because the earlier the symptoms are caught, the better the treatment.
Yeah.
And if your body is telling you something, please listen. Go and see the doctor. That's the doctor's job. And if you can't get appointments, be persistent, because and once you can do that, because you have to advocate for yourself, then there's peace of mind. But if you ignore something, it's there. When you suppress that, it's there. Yes, the stigma among our culture and all that, like I said, the people who are waving the flag of stigma do not have your symptoms. So think of you.
So it's interesting. We're having this conversation about Black men, especially with prostate cancer, and why they don't want to talk about it. And Toun was saying, because it's a private part. And I'm like, so what? This thing is killing our men. Yeah. So many men are dying from prostate cancer. And I think it's one of those that if it's caught early, you don't have to die from prostate cancer. So I don't see why gentlemen go, what's that test that they have to do again?
PSA.
PSA. Go and do a PSA test. And I don't know what age, is there any particular age that they need to start?
I think from 40 or something, but if somebody in your family has had any type of cancer, because it can be genetic, go and talk to a doctor and say, this is why I've come for the test.
Right, okay.
Don't wait. Just go. And
will the energy, if you go to your GP, for example, will they offer it to you free if you...
They will, but of course they would ask a lot of questions, and if they feel you need to have the test.
Okay.
But the first thing is to put yourself forward, and when you put yourself forward, then they educate you about how it works or how it doesn't work.
Okay. And sometimes when you go to see the GP or you go to the hospital, they try to put you off. But if you know that there's something not right about your body, then you have to persist, persistent, and just keep going back to them. There's something that's not quite right.
Exactly.
Because you know your body best.
Yeah.
You do. Yeah. Okay. So tell us more about this cancer thing.
So cancer. There's what's it called? Bowel cancer screening, which I find important because they're going to send the kit to you between the ages of, is it 50 and 59? They roll that out now, whereby they send the kit to you by post, and you have to do the test. You put your sample in the thing and post it. That means you don't need an appointment to go anywhere.
Okay.
And people who are over 60, I think 60, 75, have to request for the kit. Okay. So if you're in the comfort of your home and you can do this, that's a bonus. Yeah. You get the result in the post within 2 weeks. If you have these kits lying around somewhere, because they've sent it to you doesn't mean you have cancer. They just want to make sure that all is well.
People think that, once they talk about it or go to do a test, that means
you will catch them.
They'll catch. Doesn't catch people like that. Wow.
Yeah.
Okay. People, do go and request for the test. And I'm sure, look, whoever is listening to us now, I'm sure you know one person, if not two or three, in the last few months have died from cancer, some form of cancer. I'm not saying you're going to, and by the grace of God we won't, but let's check. Let's go for regular checkups, because you just never know.
Another thing I want to talk about is ovarian cancer. I understand that one of the main symptoms is, like my stepmom said, her stomach was swollen. I think that means bloating. And sometimes when we're experiencing bloating, we try different things, which is okay. But if things are not shifting in a week or two, go and see your doctor. Because I noticed that ovarian cancer is it's come to attention a lot nowadays, and people have died from it. So be mindful that, make sure the bloating is bloating.
It's bloating, not
something else.
Gosh, when we're having this conversation, we're just talking about how life is so tough now. So many things going on. And whatever you can do to rule out whatever it is, at least do it. If not for yourself, for your children, for your family, but please do something. Do something.
I also want to talk about cancer being hereditary. I know sometimes it can be like we're digging, but it'd be nice to talk to family members, especially the older generation, and find out if there's been any cancer in the family, because that can be a sign to go and have a genetic test, so it doesn't meet us by surprise. So questioning and finding out what's been going on with our family members is important.
Ask questions. Yeah. There's something, growing up, when somebody dies, they'll just say they died. They won't tell us exactly what it is, but we need to ask our parents questions. So this person died. What happened? What exactly happened?
Aunties and uncles, ask them.
Yeah. We need to find out what happened.
But it would be nice to know why the stigma. Why do we culturally choose to ignore things? If somebody has cancer and we refuse to talk about it, that means we're not thinking about the person and what they might go through or are going through. What do you think about that? Why is it a stigma when somebody has cancer or even mental health issues? It's the person going through it.
Yeah.
Why can't you just help them? Helping them doesn't mean you're going to get it. They're the ones suffering. But what is it about stigma? What is it about shaming others? What is it about pointing out other people's flaws? Why is that okay?
Cancer.
Exactly.
It has. And it's like, but meanwhile, when you have headaches, you don't.
Exactly. Exactly. So what is it about it? Why can't we be mindful of what other person is going through? Yeah. Because it can happen to anybody. Anybody. So this stigma thing, I think it's time we drop it.
We need to. It's just, but even though person that has it, because of the stigma attached to it, so they also don't want to talk about it.
They don't talk about it. They suppress it. Yes, I understand if they're going through treatment and they don't want anybody to know and they want to do that thing privately. But sometimes you need help. If you're going through cancer, you might need help from others because it's not an easy journey.
It's not. When you're going through chemo,
exactly, radiotherapy and all that. Exactly.
Yeah, you can hardly do anything.
Exactly. And you want to talk to someone. It's a journey you have to go for. Radiotherapy, you have to go to treatment every day. That means your life is on hold for a bit. You need to talk to someone. You need somebody to help you with your meals or anything. But they can't because they don't want people to laugh at them or shame them.
Why would anybody even want to do that?
And sometimes people are just projecting their own issues. That's their way of being in charge. I don't know.
I don't know. I don't understand, but I just hope that, we're just doing our bit in talking about it. And like I said, we've had this conversation a few times before. I don't know if people are listening or if people are passing on the message, but we will keep doing our bit to get this message out there. Definitely.
And there are different kinds of cancers. I understand there are up to 220 kinds of cancers. The other day, I just assessed the potential client who has bile duct cancer. Bile duct cancer. So it's not to scare you, but we're getting to that age whereby even younger ones get it, but we're getting to that age where we need to be mindful. We can't ignore this.
And we have to watch what we eat. That's also very important. We really have to. We're talking about how these cancer cells, they feed on sugar. So that's another thing we need to cut out of our diet. Cut out a lot of sugar from your diet, if possible. Fatty bits, fatty food.
Yeah. Because the environment in which your cells are can feed on, the cancer cells can feed on that environment. If it's not a good environment, they're able to grow and then go through the bloodstream, lymph nodes, and attach to something else. And then that becomes secondary cancer.
Okay, so let's watch our diet. Let's exercise. All these things are so important. They are really important because I want to live long, not just for myself, but also so I can see my grandchildren. You want to see your grandchildren?
Yes.
By God's grace. So please, let's do this.
Somebody was saying the other day that on social media, it says we shouldn't eat this and we shouldn't eat that, we shouldn't eat that. And I get it. You want to eat whatever you want to eat. But at this age, I'm sure you've eaten enough all sorts. And it's time to be healthy. It's time to be healthy. Sorry.
There's nothing you haven't tasted. So if you don't eat it for the next 10 years or so or more, but yeah, let's cut out a lot of this junk food. Let's try to go for more healthy options. Yeah. And exercise, at least they say at least 3 times a week.
Yeah.
3 times a week.
And drink a lot of water.
Now, I must admit, I don't drink a lot. I drink a lot of tea. So green tea and all of that.
Okay.
But I don't drink a lot of water. I really need to start
doing
that.
Why don't you drink water?
Because I'm always drinking tea.
Okay.
So instead of drinking water, I'm drinking tea. When I feel thirsty, I make a cup of tea.
All right.
So can that pass for water?
No, you have to drink water.
It's water. It's still water now.
You have to drink water.
But they say green tea is good.
Yes, it's good.
It has antioxidants, or what do they call it?
It's good, but we need water as well.
Water. Okay. I'll start drinking water now. That's my... That's
the plan.
That's the plan.
I know. I understand water can be boring sometimes.
The truth is that it's not that it's even boring for me. I drink it. Okay, when I'm eating a meal, I drink water. But if I'm during the day, if I'm just thirsty, I just get up, make a cup of tea. I won't pick up a bottle of water to drink. It'll be tea for me. So, but yeah, I know I should start drinking more water. So I am going to purpose to drink more water.
That's good.
It's Mental Health Month. Look after yourself. practice self-care, sleep. At least, is it 7 or 8 hours sleep that you need?
Yeah, but yeah, sometimes it can be difficult.
I know.
It depends on what you're going through. Maybe someone going through menopause might be struggling with sleep.
Okay, that's true. That's true. But even if you can't get 8 hours, 8 hours in one go, at least you can try and rest.
Yes, rest.
Rest.
Rest is important. But the thing about mental health that bothers me is that I see people maybe on the streets, or some have suicidal thoughts, and I don't know how they got there. It would be nice to understand how they got there or how one could help them. And I hear of quite a lot of people who have died by suicide. It's sad. It's I can't imagine what the person was going through that they now chose to, young people say, unalive themselves. So sometimes when you see people struggling, if you notice it, I'm not saying you should become a therapist or take on their burden, but you could just ask them, how are you doing? Can we sit down and talk? Let's go for a coffee. And from there, maybe they might open up, or you could advise them to talk to someone. But it's quite rampant nowadays that people choose to just leave because they don't want to bother their loved ones. They don't know what to do. Hopelessness, helplessness. They've gotten to the point whereby no way out. It shouldn't be so. I know sometimes people go through so many difficult things, but let's be mindful.
Let's be kind.
Let's be kind.
Let's extend a hand. Let's reach out to other people. If you haven't seen someone in a while, give them a call. Oh, I can't even say this on this thing, but I know someone who had been dead for 2 weeks before they found her, and they didn't reach out. They didn't reach out because they thought, oh, usually she disappears for months. They won't hear anything. But I think she had been there for 2 weeks before they found her. So reach out and visit. Take someone out for lunch if you can, or a drink. It doesn't have to be lunch, because I know everybody's going through. People are going through financial challenges. It could be just coffee
or phone call.
Yeah.
Sometimes that phone call can just save somebody.
Yeah.
Make them change their mind. Okay, somebody cares.
You know this guy that is, I can't remember. I think his first name is Kelvin. This American who survived after jumping off the San Francisco bridge. He said that when he was on his way to the bridge to jump, he was in a bus and he was crying. And nobody asked, why is this boy crying? I think he was, I can't remember, it was a teenager then. Nobody stopped him to say, are you okay? Why are you crying? And he jumped. Fortunately, he survived. But he said that if someone had stopped him that day, and said, why are you crying? That he wouldn't have jumped. But saying that, before he left the house that day, he said his dad had said, oh, hi, Kevin, are you okay? Are you fine? He wasn't crying there. And he was like, yeah, I'm fine, Dad. I'm fine, Dad. But when he got on the bus, and I guess knowing that he was going to end his life that day, he was crying, but nobody talked to him.
Another thing, what each person can handle is different.
Yeah.
So some people will say, it's just wise. We're all wired differently. Yeah.
It's just this. Now,
it's not just nothing.
Yeah.
What everybody can handle is different. Everybody's capacity is different.
Absolutely.
So we need to be mindful of that. If you're not going to help, don't shame them. Don't make fun.
Don't say anything.
Don't say anything. Just leave them alone.
Don't say anything. Yeah. That thing you just said is so true. Because sometimes we judge others based on our own experience.
Exactly.
Or our own strength, rather. But what I can handle, you probably can handle. What you can handle, I can handle.
Exactly. And sometimes we've been through stuff, if not for God.
If not for God. I mean, She has a lot of stories to tell, but that's for another day. But she has been through a lot, and she's still standing. But someone else may have just given up. So don't judge. My coach actually said that there's something we should learn not to do. That we should not judge people. We should be curious.
Yeah.
And curiosity is why. So if instead of judging someone for behaving in a particular way, why is Toun like that? Why is she doing this? And when you're curious, then you ask appropriate questions. But let's not judge, because I told you this. If you haven't walked in someone's shoes,
you have no idea.
You have no idea. You just have no idea. And even if you walked in their shoes, your path might be different.
Different shoe sizes.
Different shoe sizes, true. So we really, the truth is, there's a lot going on right now in this world. A lot. Each family has their own issues that they're going through. And I think if we cannot help, then let's keep quiet. Let's not judge. Let's not say anything. Let's not pass our own opinion. But let's be kind. Let's be kind. If there's anything else you can be, it's to be kind. Yeah.
People wear different masks.
Yeah.
We have different colors of masks. It could be makeup, it could be our clothes, it could be our wigs, anything. And we're covering up something.
Yeah.
And it's okay to do that. It's not okay if you're really struggling.
Yeah.
So sometimes you might see somebody just dress up and be really nice, and you're thinking, what's wrong with that person? They might just be covering up something. So let them be.
Let them be, yeah. Maybe that's their own way of dealing with whatever issues they're going through.
That's their coping mechanism.
Yeah.
I'm just hoping and praying that when they need help, they can ask for it.
And also, I think people will open up if they feel that whatever it is they share will be received well.
Exactly.
But if they feel that if I tell this person my story, then she's either going to laugh at me or she's also going to tell other people my story.
Exactly.
Then people will want to.
Or she's going to belittle. Or ignore.
Yes. Oh, there was this story on, I think it was on Instagram too, where this lady had called. I mean, it had nothing. It wasn't, that serious. So what happened was she had called her friend to say she was pregnant. But when she called her friend, the phone, you know the way the phone was sometimes cut off. So when the friend came back on, she just carried on and started talking about something else. So this friend that was pregnant thought, oh, I told her I was pregnant. And she didn't respond. She just carried on with the conversation. So when she had her baby, she didn't tell her friend. So her friend heard about it, congratulated her. But she too was upset that she had a child, she didn't tell me. But fortunately, after she had called her, this friend now decided to call her and said, look, this was what happened. When I was pregnant and I called you, when I got pregnant, I called you. You didn't even say congratulations, just carried on as if I didn't tell you anything. So I said, I didn't hear. Do you understand? But fortunately, they made up. But just think about it. How we just make judgments. I told her I was pregnant. She wasn't happy for me. And meanwhile, that one didn't even hear when she said it.
And that causes a lot of trouble.
Yeah.
When we make assumptions.
Yeah.
And then we act on the assumption. It doesn't make sense.
And we make a lot of assumptions. The way she looked at me, or the way she didn't look at me, or she didn't say, I mean, the number of times people have said, I said hello to you and you didn't reply. But sometimes you don't even, especially when you're in a crowd.
Exactly.
You don't even see the person, or you're so focused on getting from point A to B. And then someone will say something you don't even hear. But then they now make the assumption she's a snob.
Yeah, she's a snob. That's how she is.
That's how she is.
It'd be nice to just ask the person and just confirm that, oh, I said hi, I hope all is well. Can I help? And the person said, oh, I was on the phone, or I was busy. And then we can move on from there.
Yeah.
But before you jump to conclusions and act on your assumptions, please confirm.
This is exactly what happened or didn't happen. Yeah, you're right. They should never make assumptions. We do all the time, but we should try not to.
We should try not to, and sort of be mindful that we are, at the moment, I am assuming. That's my assumption. Maybe it's not right. I can't do anything about it now, but I don't know the true answer to this.
Absolutely.
So that way I don't act on my assumption. I wait.
Ah, gosh. Life is just... And it's so bad when you make assumptions and you find out that
it's not so.
It's not so.
Oh, God.
Like, oh, God. I'm so sorry.
But then you might have caused the other person some struggles because you don't know how weak or strong the other person is.
Yeah, that's so true. That is so true. Okay, so that's another lesson. Never make assumptions. Don't judge. Never make assumptions. Be kind. Yeah. Okay.
Because we can't control everything.
No, we can't. We can't control everything. And I think also, I'm talking about life. If you know that life is very short, and it is short, then we just try to be nice, kind, and treat everyone kindly.
That's nice, but not everybody has the ability to do that. Some people are going to be bitter till the end. And I understand they might be going through some stuff.
Yes, people have been hurt. I can understand that, but you know, there's this saying that unforgiveness is like drinking poison and hoping that somebody else will be. I can't remember how it was. But most times, when you're bitter about something, when you don't forgive someone, it's you that it affects, not the other person. Most times, the person is getting on with their life.
Yeah. And I want to take it further. You see, unforgiveness and being bitter, it eats at you. You get angry, you're not happy about something, you're jealous. It affects your health.
Yeah.
It's inward sometimes.
I want to say it's almost like cancer that is eating up here. Yeah. We really need to deal with that.
We need to.
Let go. No one is worth you're dying for. Well, apart from, I was going to say, apart from Jesus was the only one that died for us. I don't think any other person is what died for like that. So yeah, let's let go of unforgiveness and the bitterness and the jealousy and envy. In fact, I was saying to Toun today, when we're talking about all the challenges that she's been through, and I said, you know, someone will see you and be jealous and say, why is she the one always doing this, always doing that? Well, you don't know what this girl has been through. She's been through a lot. So never envy people. And you know what she said about some people, the way they dress, the way they come across, that might just be their own coping mechanism.
Yeah.
So gosh. If only, I think, if daily, honestly, we said to ourselves, okay, I see this person misbehaving. In fact, I have a friend who always says, except the person is mad. You know, you say, there must be a reason why this person is behaving like this. Why is she like this? Why is she doing this? Why is she always shouting? Why is she, you know? Let's just take time to pause and think.
Yeah.
And then hopefully we might get an answer, but sometimes we may not. We may never get an answer.
Acceptance.
Yeah. And then just walk away from what you cannot deal with.
I know we can't fix everyone.
No, we can't.
We can't fix everyone. And some people are going to remain the way they are. And so if you know you can't interact with someone, you both can get to understand each other, maybe it's time to move on.
Yeah.
Maybe you need to look for different friends.
Yeah.
Because some people don't want to hear it. And that's how they are, and we can't change them. Sometimes we have to let people be.
And going back to this mental health thing, I hope you know that your environment is very important regards your mental health. If you're in a toxic environment, it's going to affect your mental health. So if you can, get out of that environment. Some people might need to change their friends. Some people might need to change their work environment or business, whatever it is. But if that environment is not good for your health, then get out as soon as possible.
Some people might not be able to get out.
I know.
They're dependent on some people.
Some people, yeah. It's like in another 2 weeks, actually, I'm having a hangout about people who stay on in a toxic marriage where domestic violence is involved. We're going to be talking about that because it's another thing that people are dealing with.
Yeah.
And just again, trying to help to raise the awareness about the things that you can do to get out, the help that's available out there for people.
That's a tough one.
Yeah. So, yeah, but anyway, I think that's it. Have we got anything else to say?
Do we have anything else? Screenings are out there. Please attend them. They're all free.
Well, if you're in the UK.
If you're in the UK,
yeah,
they're free. Look after yourself. Tick that off the list.
And you know, it's interesting when we're setting goals for the year or for ourselves. Our health, we should have health goals too. And health goals is not just, some people say, going to the gym. Yes, there's nothing wrong with going to the gym, but then all these screenings and health checks should be part of your goals too.
Monthly to-do list. I need to check my body for lumps.
Yeah. This should be part of your goals.
Because you see that body, you want to dress up in nice clothes. Needs to be checked.
You need to check the body. No, it's true. So your monthly goal should be check for lumps, check for men, check your, what's it called now?
Yeah, prostate.
Whatever it is, it's called.
And we're not even talking about it because they're not talking about it. Check your prostate and your, what's it called?
Testicle.
Testicle. Yeah.
Testicle.
If there's any differences and one is bigger and too big than the other, just go to your doctor. Yeah, we need to talk about it because we want them to talk about it.
Yeah. No, I couldn't remember. I just couldn't remember what it was called again. But yeah, it's your testicles.
Your testicles.
I think.
You have to check that there are two of them and one is not swollen. If you're struggling to wee, go to the doctor. If you're getting up too many times at night, go to the doctor. If somebody in your family had it, go to the doctor. If there's blood in your urine, go to the doctor.
Yeah, blood in your urine, go to the doctor.
So these are things you need to watch out for. Or anything that you think is not normal, go to the doctor.
And then, I've said it, you said it. You know yourself. Don't let them say, oh, let's watch it for a few weeks. Just be persistent. Don't give up until at least they can tell you, okay, it's this or it's not this.
Yeah.
Yeah. Okay. So thank you for listening to us.
Thank you for having this discussion. It's really important.
Thank you for agreeing to do this session. It was seriously, we didn't plan it. We just planned to have lunch. And then this happened. So thank you, Toun.
Thank you, Funke.
And you're going to come and tell us more about share your story. I know you shared one part, but this other part that we talked about today, you have to come back and share.
No problem.
Thank you.
Thanks.
Bye.